Okay, good evening, everybody. We're going to go ahead and get this evening kicked off, and dinner will be coming around and being served. So it is my pleasure to welcome all of you to the Yamhill Community Care Organization Fall Forum. My name is Lori Van Zanten, and I am one of the board members for the YCCO, and I want to thank you so very much for coming tonight. This is our third annual Fall Forum, but it is distinctive because it is the first time that we have been able to incorporate YCCO members, and that is going to really benefit us tonight and make us more productive, and we're so very glad to see so many of you here, so thank you again for coming. Tonight as we gather, we've got YCCO staff, we've got YCCO members, Early Learning Council, community advisory members, board members, quite a large assortment of medical staff providers, and we'll all come together tonight. And with this great group, there are a number of things that we can do. One of the things that we like to do tonight is to look at the innovations that are happening to improve health in Yamhill County. We want to take a little bit of time and look at our community health improvement plan as well as our action plan for better health. We're going to highlight a few of the initiatives. There are so many things going on, but highlight a few of the initiatives that directly touch YCCO members. And most importantly, at our tables tonight, we're going to get good opportunities to interact and talk and learn from you and hear from you how you experience healthcare delivery in Yamhill County. What are those things that are going well, and in what ways can we serve you better? So once again, I want to thank you all for coming tonight as we work together to improve the quality of life and health for YCCO members. I'm going to go ahead and introduce our moderator for this evening, Diana Bianco.
Good. Thank you, Lori, so much. Okay, I'm on, right? As Lori said, this is the third annual event, and I've had the great privilege of working with Yamhill CCO over the last 3 or 4 years and been able to be at the event and sort of see it change and grow. And what we want to do tonight, just to echo a little bit of what Lori said, sort of 3 goals. One is to build community together around Yamhill CCO. For all the folks who are involved in the CCO, ranging from providers to members to board members to members of the community advisory committee and the clinical advisory panel. So we want to build community. And so we'll be asking you guys to have, as Lori said, some conversations at your table. The second thing we want to do is to share with you, the community, information about Yamhill CCO, sort of how it's going, what's new, what's emerging, and some sort of big overall picture, but also sort of some on-the-ground initiatives. So you'll be hearing about some very specific things. And then most importantly, as Lori mentioned, is we're going to give you all time to speak with each other and then to share with the larger group about, what are some of the most important things Yamhill CCO can be doing to improve health in the community. And so we're going to have a sort of fun prioritizing exercise together to sort of be thinking about what are some of the most important things when you think about health. What couple things that I want to ask folks to do is if you do, make sure you introduce yourselves to people at your table. And then when you do, if you get up and have a chance to say something or want to say something, tell us who you are. We have a lot to cover. We're going to be moving kind of quickly. But what what we all hope folks walk away with is a sense of community, of connection, and of learning, but also of sharing. So thank you all for being here. With that, I'm going to turn it over to Jim Carlo, who's the president and CEO of Yamhill CCO, and he's going to do sort of a state of the state. And sort of tell us where things are at. Then we'll be going a little deeper with some details. Then we'll have some sharing and some group conversation. Jim.
Great, thanks Diana. Can everybody hear me okay? All right. Did everybody get a chance to introduce yourselves? Great, well thank you and welcome. As Diana mentioned, I'm Jim Carlo. I'm the president and CEO of Yamhill Community Care Organization. We're a new organization. We started in 2012, and tonight I think, we have a lot of staff here and we have a lot of committee and board members as well who see this information every single month. So many of them will be on autopilot, but this is really designed for our distinguished guests and our members here joining us tonight. So again, thank you and welcome. We hope that you enjoy the evening with us and enjoy your meal. We're going to start a little bit at the beginning and kind of take you through the time of Yamhill CCO, talk a little bit about our beginnings from the past and then where we're going in our future. So one of the big questions that we hear from people in the community is why Yamhill CCO? Why did you get started? Why is it important to the community to have something different, as many of you imagine? Well, first and foremost, what really started this is a change in policy. So the laws changed that required a different type of delivery system for healthcare. It also included mental health, physical health services, oral health, non-emergent transportation, and some residential services. And really with the intent to coordinate that care, to look at the whole person as we think about coordinating care, looking at the emotional, social, spiritual, environmental, intellectual, and physical well-being of every member that we serve. So the backbone of that work we call the triple aim in our environment. And the triple aim was really developed by the Institute for Healthcare Improvement out of Massachusetts, which was led at the time by Dr. Don Berwick, who later became the Secretary of Center for Medicaid and Medicare Services. He's now back doing some work with the Institute for Healthcare Improvement, but the Triple Aim Foundation was really about improving the patient experience in the healthcare system, improving the outcomes of the people that we treat, and trying to lower the costs in the system. And then, of course, the other big piece of a body of work that we do is trying to identify what the needs are in the community so that we can try to help social determinants to health, which we can talk a little bit about later, as well as some of the other important things to well-being like food insecurities, transportation, and just some basic needs within the home that could be a barrier to people getting healthy or staying healthy. So this collectively, we refer to as coordinated care in this new model, which you'll often hear people referring to us as Yamhill County Coordinated Care or Yamhill Community Coordinated Care or just Yamhill CCO. But the buzzwords I think that you'll want to take away tonight is we're a community that came together to solve to the triple aim, and we're focused on the health outcomes, the experience of the system, and the cost. And that makes us a coordinated care organization in our community. So part of the work that we do, this is a diagram around a collective impact model that was started at the Stanford University. And the premise of the collective impact model was really to identify a common agenda, common measures that we can measure the work in the community, reinforcing those activities mutually, how we communicate that across the system and with the system partners that are helping coordinate this care, and then, of course, identifying a backbone organization that can serve as the collaborator in those conversations, which Yamhill Community Care does as well. So since 2012, I'll take you on a quick acceleration of some of the work that we did. We started a brand new company, which was no easy task. There were 3-hour meetings twice a month with probably 40 people at the table trying to figure out how to put this together. We had a very strong physician community that literally wrote our application to become a coordinated care organization. It was a very fast-paced project. There are now 17 of these coordinated care organizations throughout the state, with the newest being in Klamath County. So we elected a board of directors, which felt rather quick. We implemented and elected committees that were very specialized and centered around getting clinical advice, getting community input, We later became an early learning hub, so we now have an early learning committee, and that work is really to look at the 0 through 8-year-olds to make sure that we're getting kids into school, kindergarten, ready to learn, and that they don't have health as a barrier to learning, and then really thinking about the third grade reading levels of those individuals as part of that continuum. And then, of course, we filed to become a nonprofit, which was another very large body of work, but we were approved, and retroactively, which felt really, really good as an organization with a potential tax liability. So what that means is that we can, at the end of the year, instead of paying taxes to the federal and state governments, we can look at how we can budget some of those dollars to reinvest back into the community, into programs like our wellness center that you may have heard about. So early on, we did a huge amount of investing in what our future would look like. We had Care Oregon as a partner who had donated some revenue. We matched it in the community. We launched about 17 or 18 projects across the community as well. And then we later reinforced that with more transformation funds that came from the state as part of standing up the community care organizations, which later resulted in additional funding to some of the early projects and then funding a whole bunch of new projects. So I think last time I counted, it was about 32 or so active projects that we have going on across the community. So change management is a really big piece that we struggle with, being a 3-year-old organization and trying to really get a lot of the coordinated care model up and going, breaking down silos in communications, standing up behaviorists in primary care clinics, trying to educate primary care clinics on becoming a patient-centered primary care home, which allows us to start treating the whole person at the same time. So I'll talk a little bit about what we're currently doing, and whoops. All right, well, let's talk about how we're doing, and then we'll talk about what we're doing. So one of the other big questions that we have is, how does a new organization get funded? How does it do financially when we're paying for all of these medical services and thinking about funding projects and grants? And I'm going to try to give it to you at a pretty high level. So if anybody has questions, just raise your hand and I can answer some of those. So what we've seen since 2012, we started with about 14,000 members in our county service area that were eligible for the Oregon Health Plan. As you see, in 2014, the Affordable Care Act, which was part of Obamacare's policy, allowed us to grow that population by almost 10,000 people. So almost one out of 4 people that you see in your communities are now covered by Yamhill Community Care under the Oregon Health Plan. So what we're seeing is steady growth as people are affected by the economy. They may lose a job, qualify for health insurance. We become the health plan that covers those individuals. So a little peek at some of our physical health expenses. Some people are really interested in this. We track this very carefully. We look at trends for hospital services. We look at trends around the primary care costs. We look at referral services, which is a really generic category that really covers everything from radiology to outpatient surgery, MRIs, all of those other services that don't really happen in a primary care setting. And then we look very closely at pharmacy as well, and we really want to try to detect trends early on so that we can predict future strategies to help maintain the growth of expenses in the system. So what this tells us is everything is pretty predictable. We haven't seen too many major trends other than our investments in primary care, and we're starting to see, we didn't drill down in this particular information on emergency room utilization, but as a result of more primary care, we're seeing a reduction in emergency room utilization, which is really good. So the other metric that we look at is our physical health. We call it a PMPM. It's a per member per month. So we look at total costs averages across membership, and we compare that to what our revenue is from the state. And if those two bottom lines ever cross, we're in trouble. We start to go into strategy and planning mode. But we see a steady increase, and a lot of that, I put a membership arrow in there so you would see that as well. It's a direct correlation to membership. So as membership increases, so does our revenue, and so do our expenses. So it all looks pretty good. And then our total assets and liabilities year over year is what we look at to know whether or not we're seeing a huge trend in those medical costs as opposed to what we're doing in terms of reserve building and what we're able to invest back into the community. So the farther apart those two bar graphs are, the healthier we are as an organization, and the more the community benefits from the strategies that we develop and deploy. So overall, managing risk looks really, really good. So we'll talk a little bit about the impact of the work that we do. I think one of the most notable, and I think everybody in this room can attest, that they've seen a dramatic change to access to primary care. Ever since our first couple of months of operations, we've been able to get all 24,000 members assigned to a primary care clinic. We're still working through some challenges in terms of how long it takes to get an appointment, but everybody's assigned. And as those needs grow, we're working on the capacity component. Access to care is that's another component of the primary care piece, but it's not just primary care, it's access to all the MRIs, to pharmacy services, mental health services, behavioral health services for addictions and counseling. We meet monthly to talk about where the barriers are in the system and how we can improve those to make your experience a little bit better. So overall, our operations, which all of the health plan stuff that we do, paying claims, answering phones, is all working really, really well. We have some very good risk partners in this model. The county mental health system is a great partner. Our dental care organizations, we have 3 dental care organizations that we partner with, which is Advantage, Capital, and MODA. And then, of course, the collaborative work that we do to identify these opportunities is really moving forward at a really good pace. One of the other big opportunities that we had this year when we integrated non-emergent medical transportation was to decide whether or not we wanted to partner with a different organization or we wanted to take on that work ourselves locally here in the community. And our board of directors, and many of them sitting with you today, decided that we wanted to really own that responsibility and improve the access to transportation services in our community. So if any of you have had an opportunity to call WellRide for an appointment and utilize that service, we hope that you'll give us some feedback on that this evening. Everything that we hear is that people are really pleased. They're getting quick access to transportation and getting to the appointments that they need. So this really, all this work that we're talking about really gets to how we impact the community, which was really the premise of starting the organization back in 2012. And every indicator that we look at shows that we're doing the right work at the right time and at the right place to make sure that each of our members are having a good experience and good outcomes in their health care. So a little bit of where we're going, and I know that we're running a little late on time. One of the big bodies of work that we do this time of year is our strategic planning. We did a session 2 years ago, which we titled, as Lori mentioned in the beginning, our action plan for better health. Some of it you'll talk about at your tables tonight because we'd really like to get some feedback from you on where we're going with some of those key initiatives. But we just closed out a session. It was probably a 3 or 4 month session that involved the staff, the board, and community members getting input. So we now have a 3-year strategic plan that we're planning to revisit once a year to make sure that we're on track. And then, of course, the major benefit of this is all of the community health improvement work that we're doing. And some of the key areas addressed in this new plan is chronic diseases, behavioral health services, oral health services, and primary care around some capacity and innovation of building out practices into care homes. And then, of course, another body of that work is evaluating our services that we do constantly to make sure that we're looking at high-value, high-touch services to each of our members to make sure they're getting the very best care with local knowledge about how to solve those challenges. So we're going through some thinking right now about which services do we currently outsource to another company that we might want to bring home to Yamhill around possibly medical case management and our community health worker hub. Some of you may have worked with in the past. We're looking at growing that model so that we can help you navigate the system and get the care at the right place at the right time. And that's all I've got. So I think just thank you for coming tonight. Enjoy your meal, enjoy the engagement, give us great feedback, and be well.
Invite Jim Rickards to come up, and he's going to go a little deeper. So that was sort of a bigger picture, and Jim number 2 is going to come up and share some more details on some of the programming. And all of this is to get us set up for the conversation we'll be having in about 10, 15 minutes.
All right, is this on? Yes? Okay, great. Let's see here. Okay, great. So, yeah, interesting wrinkle of Yamhill County is your name has to be Jim in order to speak in front of people. So I was one of those fortunate people to be named Jim. Anyway, my name is Jim Rickards. I'm the Health Strategy Officer for the Yamhill CCO. I'm also a local actively practicing radiologist here in town at Willamette Valley Medical Center. And I was asked to speak a little bit about what the Yamhill CCO is doing as an organization to improve health in Yamhill County. And to do this from the perspective of some of the on-the-ground initiatives we've helped implement and support in partnership with our various community partner organizations and our provider network. So before we get into some of the projects, I first wanted to talk a little bit about health insurance. So in the United States, you can get provided health insurance in basically one of three main ways. The first way you might be able to have health insurance is if you have commercial health insurance. This is health insurance you typically receive through an employer as an employee benefit, or maybe you purchase it on the health insurance exchange. The second type of health insurance in the U.S. is what's called Medicare. This is health insurance for typically elderly individuals 65 or over, and it's a government-supported type of health insurance. And the third type of health insurance, which is most relevant to our conversation this evening, is what's called Medicaid. This is another form of government health insurance, and it's provided to individuals based on certain economic and financial qualifications. Now, in the state of Oregon, these Medicaid health insurance benefits are administered by or provided by organizations called Coordinated Care Organizations, or CCOs. The Yamhill CCO happens to be one of 17 Coordinated Care Organizations in the state of Oregon, which provide these Medicaid benefits. So that's all great. So what does health insurance have to do with improving health? Well, really everything. You know, the research shows, and it's just kind of common sense, that if you have health insurance, you're going to have better health outcomes. So if you have health insurance, if you have a medical problem, you're more likely to seek the care of a provider earlier before it becomes severe and possibly life-threatening. Is this kind of weird? No. Or if you have health insurance, you're more likely to have preventative services, such as having a mammogram to detect early signs of breast cancer earlier on. And also, if you have health insurance, if you have a chronic condition, you're more likely to undergo regular management of that chronic condition, mainly because you have access to a provider network that can help you with it. And you also have prescription insurance benefits that can help you control that. So the health benefits of having health insurance are clear. And fortunately, over the last several years, we've been able to greatly increase the number of individuals that have health insurance throughout this country, largely as a result of Obamacare. So my first picture here, this kind of shows where we were back in 2013 before Obamacare really took hold. So part of Obamacare, or the Affordable Care Act, was really aimed at increasing the number of individuals who had health insurance in the United States. And that was largely through this process called the Medicaid expansion. And that really started to happen in 2014. So if we look here in 2013, all these pink areas are places in the country that had greater than a 9 to 10% of their population that didn't have insurance. In Yamhill County, we actually had about 17% of our population, or around 17,000 people, that didn't have health insurance. This is where we are now. So like a lot of the rest of the country, we've been able to dramatically decrease our number of uninsured individuals. Currently, we only have about 9% of the population in Yamhill County that's uninsured. So we've been able to decrease that uninsured rate in half in just 2 years. That's pretty incredible. And that's what's been reflected in our membership. You know, as Jim was sharing, we went from about 12 to 13,000 members up to more than 25,000 members. So I think when we talk about what the CCO has been able to do to improve health in the community, the fact that we've been able to provide health insurance to so many people is probably one of the largest things we've been able to do. So the CCO, you know, I think I've kind of established we're, you know, basically kind of a health insurance payer, but we're actually a lot more than that. You know, we don't just pay for your typical medical benefits like going to see a physician. We also pay for behavioral health services along with dental care services. But, you know, I think as an organization, we're even more than that. So when we first came together as a community, a group of really kind of passionate stakeholders, you know, we wanted to create this organization that not only would just kind of pay for healthcare, but also kind of revolutionize and transform the healthcare system. We saw it as this platform and as a mechanism to improve the quality of healthcare we delivered, as a way to bring together providers and members to work on programs to really, you know, improve the patient experience and to really get better health outcomes and do this all with lower costs. And I think, you know, that's kind of the framework that I like to think of the CCO as, you know, really not just as this healthcare payer that's paying some medical bills, but really as this helping hand that can extend out in the community, that can work with partners or maybe children outside that are playing and support various programs. And I think that's what we've been able to do so far. And these are just a variety of the programs we've been able to support. So with that in mind, let's dive a little bit deeper and talk about some of these programs. But before I get to that, I want to touch briefly on this idea of the social determinants of health. So, you know, 8 or 9 years ago, if you would have asked me what it takes to be healthy as a physician in my medical model mindset, I would have said, oh, well, you need to have a good doctor. You know, you need to have access to world-class healthcare. You need to be by, you know, some hospital that offers, you know, incredible imaging services like, you know, the hospital I work at does. But it turns out that in so many ways, I was kind of wrong. And I had about 20% of it right. You see, only about 20% of your health is actually impacted or affected by your physician or the health care you receive. So much more of your health is actually directly affected by these other things called the social determinants of health. And so if we really are a healthcare organization, the CCO, and we really want to improve the health of our community, we've got to move beyond just being this kind of traditional payer of medical bills, and we've got to work on these social determinants of health. We've got to work on this 80% out here. You know, so these things are like, so what are these social determinants of health? They're things like our health behaviors. So do we exercise? Do we smoke? Do we drink too much? You know, there are things like socioeconomic factors. Do we have gainful employment? What's our level of education? Do we live in a safe community? And it's things like our physical environment. Do we have a safe, stable housing environment? Is our housing environment clean? Do we have utilities? So, you know, if we really want to improve the health of our community, and we are a healthcare organization, you know, this is where most of the work is out here. And, you know, fortunately, we have the CCO that is an organization that can support that kind of work. And that's what we've done with a number of the programs we've put in place, such as our community hub. So this is one of the first programs I wanted to highlight. This is our community hub. It has 5 members, our 3 in the middle. These are our bilingual, bicultural community health workers, Christian, Abraham, and Jose. We also have Jennifer, our member engagement specialist, and Debbie, our nurse case manager. And these are the folks that are the core part of our team that are working on these determinants of health out here. You know, they're not physicians. They didn't, you know, kind of spend a lot of time in med school like I did, and that was a great time. You know, I'm not trying to say it was a bad time, but, you know, these guys are doing some of the hardest work out there when it comes to healthcare. And so I think maybe a story that Abraham shared with me really exemplifies that. and can kind of, put some color around the kind of the work they can do in addressing the social determinants of health. So the first member that Abraham was assigned to work with as a community health worker was a disabled individual who lived in a kind of unstable housing situation, was in an abusive relationship, had a lot of chronic medical problems, and had a habit of calling 911 and going to the emergency department. So the care was not regular, it was very expensive care. So Abraham was referred to this individual because of the frequent emergency department visits, was able to develop a relationship with them, and realized that one of the major barriers they faced was transportation. They just simply couldn't get to their primary care physician office visits. So he was able to connect the individual to the Well Ride program, get them transportation to the primary care clinic, was also able to identify that the individual had a number of behavioral health issues, was able to connect them with Yamhill County Adult Behavioral Health Services and get them into counseling. So as a result of that, the individual now is receiving more regular care and not going to the emergency department and having decreased costs of care. Another program we've supported is our Early Learning Hub. So we actually are the only CCO in Oregon that has an Early Learning Hub embedded within it. Early Learning Hubs are community-based organizations that work to improve the educational outcomes for underserved individuals. I think some of the work that our Early Learning Hub has done really exemplifies this. We've started the Ready for Kindergarten program. It's a program that we've supported in partnership with 7 school districts that is based around a series of workshops in which parents and toddlers can attend, in which they learn habits of productive play, and they learn how to, parents learn how to interact with their children in order to teach them skills around learning and curiosity, so when they start going to school, they're actually ready to learn. We've also supported the SNACS program, the Student Nutrition and Activity Clinic for Children. This is a program started out at Physicians Medical Center. This is one of our larger primary care clinics. The physicians at this clinic realized that childhood obesity was a growing problem, and that they thought a lot of the problem was rooted in the fact that children simply didn't know what it meant to eat healthy. They didn't think that children understood the value of exercise, and that a lot of time was being spent on iPhones and in front of computers. So with some support from the CCO, they were able to expand this program. It's now an 8-week curriculum-based program in which children work with an intern from Linfield College to learn this Live 5-2-1 approach of eating 5 fruits and vegetables a day, having 2 hours less of screen time, at least 1 hour of physical activity, and consuming almost no sweetened beverages. And then finally, we still have a lot of work to do. Looks like I lost the title, but we have a big problem in our community with prescription pain medications, as in the rest of the United States. And this is closely linked to problems related to persistent and chronic pain. A lot of our members unfortunately suffer from persistent and chronic pain, and so often the chronic pain does have a true physical cause. There has been an injury or something that is causing the pain, but then so often our members have associated behavioral health and mental health problems that exacerbate that pain. Unfortunately, physicians, when you go to see your physician and you have chronic pain, there's only so many tools that they can use to help you, and there's only so much time in the day. So, oftentimes in the past, people received pain pills if they had pain. But unfortunately, that's not a good way to address this problem. So what we've been able to do is come up with another solution, and that's our persistent pain program. Essentially what this is an 8-week program in which individuals take part in both a classroom learning session where they can learn about the triggers for persistent and chronic pain and skills for dealing with it more effectively, and then also take part in a movement therapy class. And what we've been able to demonstrate with this program is a dramatic decrease in the number of our members on chronic opiates. So with that, I'd like to thank you. I hope I kind of provide a little bit of education on the importance of social determinants of health and some insight into how the CCO is addressing these determinants of health and moving beyond just kind of the medical model of providing sick care, but really working with the community and a variety of partners to truly provide health care. So thanks.
Good, Tim. Thank you so much.
Yeah.